Hi, my name is Jenna. I'm from Sterling Heights, Michigan, and I just finished my follow-up at the POTS Treatment Center in Dallas, Texas. Before coming here, I was so stressed out. I was actually a wreck. I had just come off of another trip, and I was extremely physically and emotionally drained. And I really needed to be here. And Andrea actually worked with me most of the week on managing stress, and we went over how to deal with outside situations that I can't control and past and future events that have been bothering me and that I'm anxious about in the future, and how to just calm myself down in a situation where I'm getting intense anxiety. And it really helped me to move forward with not letting those things get to me, because that really was making me symptomatic beyond what I should have been. And it has really brought up my temperature from my first day, and my first day I believe at 74, and today I brought my temperature up to the 90s, and that's a big improvement for 5 days. And before I came here, after my first visit, I had a surgery. I had to have my feeding tube removed because of a complication, and I had to have a bowel resection. I had to have part of my intestine removed. So I was unable to actually do the home program for about 2 weeks, and I was very scared that I was going to go backward. And actually, I maintained my results very well. I maintained my blood pressure and my heart rate at a normal level for most of that time. Back in August, when I first arrived at the POTS Treatment Center, I walked in here with a cane, and most of the time I was using a wheelchair. I couldn't walk because the cramping in my legs was so bad. When I got home after my first trip, I actually was able to jog a little bit on the treadmill. I wasn't full-blown running, but the fact that I was able to jog was a miracle. And I also, a week after I got home, I was able to get my PICC line removed because I was able to drink enough water and sustain hydration myself without needing a central line. And I did have my feeding tube removed, not under the best circumstances, but to have a PICC line in my feeding tube removed before my follow-up was a big accomplishment. If you're thinking about coming back for the follow-up, I definitely recommend it. We did a lot of postural work, going from a sitting to a standing position, which is the P in POTS, and it really helped me learn how to control my heart rate in situations that are pretty much most of your life. Standing up is, when you're standing up just in a normal situation, how crazy your heart rate really can be, and now you can learn how to control that through the follow-up, and we did that all 5 days, so it's definitely recommended. So thank you, Dr. K, thank you, Andrea and Katie, for everything you've done for me this week. And for my first trip here too. I really appreciate you giving me my life back. I couldn't have done it without you.